Hi everyone.
Hello,
A very good
Mahima. Hello,
afternoon.
everyone. Thank
Very
you. Good
good
afternoon to you
afternoon.
too.
Good afternoon. Welcome to Mom Story Talks by Mom Story by Sahyadri Hospitals. And I am Dr. Mahima Bakshi. My guest today is Dr. Mini Salunkhe, who's Director and Head of Department of Obstetrics at Sahyadri Super Speciality Hospital, Hadapsar. Hi, ma'am. Welcome to our show.
Thank you, Mahima. Thank you so much. In this audience, August audience, I would like to introduce our very own wellness expert, Dr. Mahima Bakshi. She's a very well-known mother and pregnancy and child expert, a wellness expert, and she's the brand ambassador and consultant for the Mom Story Group of Hospitals, Sahyadri.
Thank
So,
you so
welcome to
much,
the show,
ma'am.
Mahima, and thank you for hosting it as well.
Thank you so much, ma'am. It's a pleasure. I'm excited to be discussing about holistic approach in pregnancy with you. बहुत सारी महिलाएं जो हैं when they start expecting a baby, उनके मन में बहुत सारे सवाल आते हैं. एंड अ लॉट ऑफ देम नो कि यस डॉक्टर के पास जाना है, डॉक्टर जो टेस्ट बताएंगे, जो मेडिसिन बताएंगे वो लेना है. लेकिन उसके साथ साथ में भी एक होलिस्टिक अप्रोच इन प्रेगनेंसी जो कि उनको हेल्प करे ताकि उनको प्रेगनेंसी में कंफर्ट मिले, कॉम्प्लिकेशंस कम हो, बेबी की ग्रोथ अच्छी हो, उनको बहुत ज्यादा डिफिकल्टी ना हो. उस बारे में आज हम डिस्कशन करना चाहेंगे. अकॉर्डिंग टू यू एज अ गायनोकोलॉजिस्ट ऑब्स्टेट्रिशियन, आपके हिसाब से दी करेक्ट होलिस्टिक अप्रोच इन प्रेगनेंसी क्या रहना चाहिए?
Thank you, Mahima. The question is a very important question. And you know what happens that in our daily OPD practice, what happens that when the patient comes to us, the holistic approach to pregnancy is a very important thing. Why we chose this topic of holistic approaches, the physical development of the mother and the baby, then the mind and the spirit, that is the spiritual. So these three things come in holistic approach. And to have a healthy and a happy pregnancy and a healthy and a happy baby, it is very important to merge all these three things, the physical, mind and the spiritual, not only of the mother to be but also of the family. In India, what happens that we have seen and we know very well that it is not only the patient who is pregnant, the mother who is pregnant, the whole family, the extended family, the near and dear ones, all of them are involved in the pregnancy. Sometimes there are a lot of myths and turbulences because of this, but it is important to educate the mother holistically for the holistic approach to pregnancy as well as the extended family. So, here the basic foundation of the holistic pregnancy or holistic approach to pregnancy would be diet and exercise. And that's why it is very important for the two of us to discuss today what is the holistic approach. Because I, as a gynecologist and as an obstetrician, definitely beyond the holistic, I would tell the patient about the interventions which are absolutely necessary, but you as a wellness expert are going to give us very valuable inputs regarding how to make this pregnancy more and more holistic, and especially in this world which is full of stress, because all the pregnant women who are coming to us are probably in the age group of 30 to 40 or 30 to 35, and their lives have been very stressful. They are stressful. They are all educated literate women who are managing the homes as well as their offices. And in this stressful life, the holistic approach is very important, because just to tell the patient, okay, come now, this is the first, second and the third trimester, now now we'll discuss about the normal labor and delivery. So this becomes a very drab kind of a thing, because I realize in my day to day OPD that how important it is for the pregnant woman to approach the pregnancy in a very positive way without any negativity, so that she is totally prepared for in those 9 months to gear up for the delivery. So that is why I think, Mahima, this topic that we have chosen is very important.
Absolutely, I agree with you, ma'am. I think it is essential for couples to understand that when a woman is planning her baby or expecting a pregnancy, she needs a lot of support from her family, from her husband, and especially, like we say, that, taking care of the diet and exercise. We should not only force the pregnant woman to follow a strict routine, but if the husband also does it with her, it will become easier for her to
Absolutely.
follow.
More enjoyable.
Yes. Otherwise, she will feel like only why I only have to go through all this.
Yes, yes, that's true.
So if husbands can also participate and they can also change their lifestyle, it'll become easier for the woman to follow it. And
Right,
specifically
right,
for diet and exercise, like you also have mentioned. So I think the first and the most important rule for diet is to have ghar ka khana, which is the
right,
biggest challenge in today's time with easy access to online food for everybody. I think it's the ghar ka khana in pregnancy which will really help a pregnant woman to be able to enjoy a healthy pregnancy. And secondly is having healthy foods. So yes, we do get tempted to foods that are unhealthy for us, and cheat days are okay to have. But overall, if we look at 5 to 6 days in a week, she should be able to have healthy foods covering all the five food
right, right,
groups which are important, and specifically preferring ghar ka khana, non-spicy food, and foods without preservatives, which means fresh food instead of
right,
buying
right,
packaged foods. So I think the biggest challenge for working moms these days is that they don't have time to cook, and because of which they end
right.
up ordering either ready-made food or they take packaged foods or they take instant foods, which I feel is the biggest challenge for pregnancy. What is your opinion on that?
Absolutely. Absolutely, absolutely. In these 10 tips of the holistic approach to pregnancy, definitely there is a lot of emphasis on good diet. And this good diet should in fact start a little before the conception itself, because that is the time when the diet plays a very important role. Because when the patient comes to us before the pregnancy, at that time itself, if you work on her diet, if you work on her BMI, her weight,
Yeah,
and of course the supplements like folate, which are very
yeah.
important to prevent any neural tube defects in the baby. So the diet actually starts right from the beginning. And preconceptionally also, when the couple comes to us, we are very emphasis is given to her BMI, her weight
Mm,
before the pregnancy, how much weight she should gain in the first 3 trimesters, and what is the diet which is essential for her, which is less of carbs and sugars and more of proteins. So, protein content, vitamins, your supplements, your minerals, good healthy fruits, less of whites like white bread, maida, bakery products, then
mm,
some potatoes and this thing. Some women even have to be off wheat and rice also to some extent, because
mm,
there are increased chances as the age grows also of
mm.
diabetes in pregnancy and hypertension in pregnancy. So, diet is
Right.
a very, very important foundation of a holistic pregnancy.
Absolutely, ma'am. So I think weight also plays a very important role because normally we see mother-in-laws having a lot of concerns कि ये pregnant है इसका वजन ठीक से नहीं बढ़ रहा है, and they expect कि if a woman is pregnant she should gain like nice good 20 kilos in her pregnancy. But people need to understand that nowadays the lifestyle is very different, and considering the pre-pregnancy weight, it's not necessary that every pregnant woman has to gain 20 kilos. It can vary from
Absolutely.
person to person.
Person. And don't eat for two. That is the main tip
Yeah.
that is given. So, the
Yes,
myth is that
yes,
you're eating for two, which is
yes,
not the right thing to do. Eat
yes,
and be healthy and happy, but eat proper food and nutritious food.
yes, absolutely. I think just an addition of 1 to 2 more meals in your day, which could be mini snacks. I think those
Yes,
snacks also, if you add to your daily routine, will help you to meet the calories that are required for your pregnancy
absolutely.
intake. But there's no need to eat for two just because you're pregnant.
Right, right,
And a balance of exercise. Now, because we are also talking about diet, we know that whatever we are eating, it has to be digested in the right manner. We have to
right,
burn the calories in the right manner. So, a lot of women think that if they are pregnant, they should not exercise because it can be scary for them or they are scared to exercise in pregnancy.
right, right.
So, exercising in pregnancy overall will not only help you to burn your calories and keep your weight under control, like indigestion and constipation, which is very commonly seen
Constipation.
in pregnancy. So, ma'am,
Absolutely.
anything you would like to add to that?
Yes, in exercise, also in India, there are a lot of myths,
Hmm.
because I really do sometimes find a difference between the Indian women and the expatriate women who come to us, who are in a way very, very healthy regarding their
Hmm.
protein intake and their diet and their body. And it's this is what happens, that there are a lot of myths that in the first trimester, don't do this, don't do that, I agree
Hmm.
that the implantation is happening, the zygote is embedding in the
Hmm.
uterus after the first week, and the first 3 months is important because we don't know where the placenta is located. It is a global all around placenta. Some women may bleed or spot during the first trimester. So, when any couple comes to us, it is difficult
Hmm.
to generalize the diet or the exercise. It depends on their obstetric and their physical condition. So here, if the it is only obesity and she's a low risk pregnancy, she doesn't have any problems like she may not go into premature labor, or she may not spot, or she doesn't have placenta previa, then 30 minutes of exercise is definitely advocated throughout the pregnancy. Usually, what happens that when the couple comes to us, if we see that it is first a low risk pregnancy, she doesn't have any previous bad obstetric histories, no history of any cervical stitch given. Is there a history of any threatened preterm labor or a history of hypertension? Then, in those
Hmm.
cases, we have to modify their exercise regime, take the help of the physiotherapist, and tell them that only upper body yoga, meditation, deep breathing exercises can be done.
Hmm.
Don't you avoid physical pelvic exertional exercises, heavy lifting of weights or pelvic this thing aerobic zumba or even surya namaskar. So that thing can be avoided in certain category of women. Second trimester onwards, when we know that the placental localization has been done, she's a low risk pregnancy, we advocate all the exercises as your
Hmm.
pre-mom sessions a very good it is a
Hmm.
very good platform where my patients are learning so much from you. And later on, as you know, that the ball exercises and everything, which you'll tell in
Hmm.
detail, of course. But only thing is generalization of exercises. As an obstetrician, I would be just careful to tell the wellness expert that the history should be taken properly as
Hmm.
to which patient would fall into which category. But definitely, to gear up for a vaginal delivery, the pelvic exercises right from the beginning, Kegels exercises are definitely advocated. So the women should start Kegels exercises, and that is the main strength of her pelvic muscles and the urinary bladder and the rectal muscles. Very important post delivery also.
Right,
But
absolutely.
on
So
an
only if the
average,
woman,
30 minutes, yeah, yeah. On an
yeah,
average, 30 minutes of exercise daily walking
yeah,
is a very good form of exercise.
absolutely. 30 minutes minimum rule every woman should follow. However, taking a green signal from her gynecologist before starting with these exercises will be really great because it will help us to prevent any sort of, any
Right.
risk factors if involved. And also, if she's able to continue during her pregnancy, it will also help her to improve her chances for having an easy childbirth, normal delivery, and plus even the postpartum recovery. Like you said, that even postpartum exercises are important, diet is important, but only if she's able to follow it in her pregnancy, she'll be able to continue. So it's not
Right, right.
just the delivery or the post delivery or even just the pregnancy. Actually, it should start before the pregnancy so that the woman can continue that lifestyle during her 9 months and even after the delivery.
Absolutely, Mahima. I totally agree with you. So basically, the basic foundation, as we have discussed, is the eating well. Another important thing in holistic pregnancy is hydration.
Hmm.
Hydrate your body properly. And what happens many a times, the patient and the mother to be is not taking enough of water in her
Hmm.
daily routine. Then there are increased chances of urinary tract infections because the immunity in
Hmm.
pregnancy is less. Women are usually working on the laptop for say 10 to 12 hours at a stretch. So we tell them to get up, to hydrate themselves. Most of the women would forget drinking water. You
Yeah.
feel hungry and you eat, but that 3 liters of water or 2 liters of water at the bedside or near your office, very important. Very important that you stretch every 2 hours and drink a lot of water. So
Hmm.
basically, in holistic approach to pregnancy, these are these very
Hmm.
small things which holistically someone may forget, and that may lead to complications, because in the first trimester anyway the mother is suffering from a lot of nausea and vomiting sensation.
Hmm.
So there is a
Hmm.
lot of vomiting also. So this leads to a condition called hyperemesis, in which she is vomiting a lot, and she cannot take very good care of her health because of that. So to
Hmm.
alleviate these symptoms, there are very small holistically some things can be approached, like little bit of ginger, some gharelu nuskas,
Hmm.
a little
Hmm.
bit of water, coconut water, dry
Hmm.
fruits, what she likes, and put ginger in your mouth. So small Indian traditions also, and small nuskas would also help her tide over the first trimester blues.
Absolutely, because in the first trimester, mother has a lot of apprehension. Oh my God, I'm pregnant. What is going to
Yes,
happen? So I think even that stress also kind of aggravates the morning sickness or nausea and vomiting. So
absolutely,
very important to stay
absolutely.
relaxed. So a little bit of breathing exercises or relaxation techniques can also help. And like you mentioned in food habits, you can have some ginger. Ginger water can be very beneficial. Ginger tea is quite beneficial. But one needs to avoid spicy food because that will aggravate the acidity. And having little
Absolutely.
portion sizes of food, but more frequently can also help them. So frequent but smaller size, and also important to have small snacks. So if you're unable to have
Yes,
proper meals, maybe अगर आप दाल रोटी सब्जी पूरा meal नहीं खा पा रहे हैं, you can have small snacking options. So idli, dhokla, upma, dosa, chila, maybe these kind of foods is something you might enjoy eating more comparatively. But you can just
absolutely,
ensure that every 2 to 3 hours you're having something for sure instead of skipping your meals. So आपको meal skip नहीं करना है, specifically in the first
absolutely,
trimester, क्योंकि सबसे ज्यादा
absolutely.
प्रॉब्लम फर्स्ट trimester में ही आता है.
And what would you advocate, Mahima, when you are taking your pre-mom sessions also? What type of exercises do you advocate in the first trimester?
Yes, ma'am. So because first trimester is somewhere where we really don't know whether you're going to convert into a high risk pregnancy or not. Is the placenta going to be okay or not? Is there any chance of bleeding or spotting or not? So it's always better to be a little cautious in the first trimester. तो मेरा
Right.
बेस्ट एडवाइस ये रहता है कीपिंग सेफ्टी इन माइंड इज दैट डू लॉट्स ऑफ बेड एक्सरसाइजेस डोंट गो ऑन द मैट. तो आप नीचे मैट पे
Yes.
मत बैठो, आप बेड पे बैठो आराम से, और बेड पे बैठ के आप आराम से बेड एक्सरसाइजेस करो विच आर सेफ फॉर यू. So like you said,
Right.
upper body exercises, the stretching, relaxation techniques, a lot of breathing exercises. You can do some lower body stretches also. But better to avoid the pelvic exercises in the first trimester.
Absolutely. And lot of stress busting is needed, Mahima. Nowadays I see that
Hmm.
most of the women, because they are unable to, it's very difficult for them to manage the office and the home, and the
Yeah.
main problem is the stress they are undergoing. And because of this
Hmm.
stress, sometimes a normal pregnancy also becomes abnormal, because of your
Hmm.
stress
Yeah.
and your the stress levels in the house and in the office, most probably are leading to some unwanted hormones and unhappy hormones, and
Yeah.
they are this the tendency to take the pregnancy as it is and be happy, and kind of that these things are going to happen in the first trimester. So how can you not complain and go ahead the first 3 months or even the whole 9 months of pregnancy?
Hmm.
I feel that happiness quotient is sometimes very much
Yeah.
lacking nowadays because of the
Yeah.
stress, and because of that, they are very stressed out, because each and every pregnancy becomes for them, for the mother to be, becomes a high risk when actually she's a low risk pregnancy. So this
Hmm.
holistic approach in which the mind, yoga, spirituality, and some
Hmm.
meditation and deep breathing exercises has now become a very important part of the whole holistic approach in the whole 9 months. Because
Hmm.
there are so many, what I feel sometimes looking at the research also, that many a times
Hmm.
because of this stress there are many developmental problems in the child
Hmm.
also, when the child is born and
Yeah.
later on. So this type of a thing, the stress busters are necessary.
Hmm.
Preconceptually also, you have to go into the pregnancy with a very clear mind, very happy, happy frame of mind, and also
Hmm.
in all the three trimesters. And for that, it
Hmm.
is very important for you and your provider, healthcare provider, your doctor, to how to sail through pregnancy without having undue stress. The more
Hmm.
the women go through Google and the more they read, the more they get some
Yeah.
inadequate knowledge, because of
Yeah.
which they are becoming more and more stressed out for
Yeah.
conditions they may not be even going to suffer.
Hmm. Totally.
So that is
Absolutely. I
where the
think.
wellness expert, the wellness expert here is very important
Yeah.
for that.
Yes, ma'am. Very well said that it's important to control the stress levels as well. And I think
Right.
the biggest support for working moms is support of the partner. तो जितना husband
Absolutely.
supportive होंगे उतना easy मम्मी के लिए होगा. लेकिन अगर family support, husband support missing है उतना ही मुश्किल मम्मी के लिए होगा. So I think husbands play a very
Absolutely.
important role in this.
Absolutely.
Especially
Another tip
accompanying
which I
for,
would, yeah.
डॉक्टर विजिट, जब भी गायनी विजिट है, हस्बैंड्स को कहीं ना कहीं फुर्सत निकाल के साथ में जाना चाहिए, कोई अल्ट्रासाउंड स्कैन्स है, हस्बैंड्स को साथ में जाना चाहिए, so not only the
But
mother who
now,
is
nowadays, I
pregnant.
would say, Mahima, that the husbands are really
They come.
supporting the wives, because I see most of the couples, they're coming
Yeah,
as couples. They don't
that's
come
very
alone.
nice.
And
Yeah.
yeah, and even the husband's participation in the labor room is really great,
Mm.
really great. So we always call the husband in the labor room when the patient is delivering, and it is a very very nice experience for the husband,
Yeah.
and it is very important. It is very comfortable for the doctor also, because the doctor can show what is
Yeah.
going on, and the husband is
Yeah.
totally, he's in tune with everything that is happening. So an empathetic
Nice.
husband and a partner is very important.
Nice. Lovely, ma'am. So, ma'am, I would also like to add on one question here. Now, in case somebody has not been able to follow a proper diet or a proper exercise or has been taking a lot of stress and can end up with some sort of, difficulties or health issues or pregnancy issues, like commonly that we see is gestational diabetes or hypertension. So, as an obstetrician, from your side, we would like to know more about what is the first red flag or a danger sign for a pregnant woman to know that, oh, I might be suffering from gestational diabetes or gestational hypertension? These are my red signs or danger signs. And now I must go in for my proper investigations to know whether I actually have it or not.
Yes, yes. This question is very important, Mehma, and thank you for asking it. Actually, basically, here, because India is the diabetic capital of the whole globe, of the whole world,
Mm,
that
mm,
incidence of diabetes in pregnancy is increasing a lot. And many of the women, they are definitely aware of all these things.
mm,
The incidence of PCOD, polycystic ovarian syndrome, and the
mm,
hormonal disturbances because of PCOS, especially obesity, is increasing in India. So we find in our OPD that many couples are coming preconceptionally itself to understand what are the investigations that they should be doing, or is their BMI more, or is their weight more, and what type of exercise and diet they should be doing to have a holistic and a healthy pregnancy. In case the pregnant woman comes to us in the first trimester or the second trimester and she has absolutely missed any investigations or the preconceptional counseling, then the red
mm,
flags would be a sudden steady increase in weight, which is much more than expected, and
mm,
a feeling of lethargy. The BMI is more, the obesity is increasing, she has frequency of urination, and she has some infections like vaginal infections or urinary infections which are not getting treated properly, and they are becoming recurrent. So at that
mm,
time, she may complain of some vaginal discharge, which is recurrent and it is getting itchy, some burning in the urine, then excessive weight gain. So these are the
mm,
red flags in which we would definitely investigate her further into the history of diabetes and the tests for diabetes. But usually, what happens that, as I told you, right from the preconceptional time itself, we are ruling out PCOD. We are trying to maintain a BMI for the patients, which is, within 18 to 25. We are doing their thyroid and their sugar levels earlier. And as they
mm,
get pregnant, in each trimester, we would be doing the DIPSI or the GCT test, in which we would give them 75 grams of glucose and check the sugars after 2 hours. In some
mm,
patients, we can do a fasting and the PP sugar. And in
mm,
those women who've already had PCOD and they're already on metformin or some insulin resistance tablets, we would be doing their HbA1c also, which is a 3 month sugar control.
mm,
So, and then only we would tell, probably in preconception, whether to go ahead with the pregnancy or not.
mm,
The important red flags for thyroid also, the TSH should be less than equal to 2.5, and the HbA1c has to be between 5 to 6. Because if the
mm,
sugars are not well controlled in the first trimester or preconceptional, chances of multiple anomalies in the babies are more.
mm,
So, and each trimester, as we had discussed earlier, that the weight gain has to be monitored very carefully. So,
mm,
initially in the first 3 months, we wouldn't expect much of a weight gain. There might be some weight loss. Later
mm,
on, 1 to 1.2 kilos per kilogram per month is enough. Now, if the
mm,
patient is, the BMI is more than 25, she's an obese patient, the weight gain, even 5, 6 kilos of weight gain is okay,
mm,
because she takes more proteins for the baby. Baby will grow very well with
mm,
proteins.
Hmm.
And if the patient is between the BMI of 18 to 25, okay, even 15 to 18 kilos is okay weight gain. So the red flag here would be basically the sugars and the weight gain.
Hmm. Hmm. Now,
Another thing
since
is
you've,
how to,
yeah,
yeah, and obstetrically through the sonography, which is very important
ultrasound.
because sonography shows signs of diabetes, even if the sugars have been normal. You know what happens many times? We have done a sugar last month. Suddenly, this
Hmm.
baby in the second trimester, in the ultrasound late second trimester, big baby, lot of
Big baby.
water. That is the liquor amni and the liquor, which we call it, the amniotic
Hmm.
fluid. It has suddenly become more, the baby has
Hmm.
become bigger. See, genetically, some babies will be bigger depending upon the size of the parents. But if the
Hmm.
parents are normal size and the baby is becoming very big, so that is all swelling and excessive weight gain and more of amniotic
Hmm.
fluid because of the sugar. That means this
Hmm.
patient's sugar is fluctuating and she is not realizing it.
Hmm. Interesting, interesting. So since you've also mentioned about role of protein in the growth and development of the baby, I would love to know more about the role of supplements in pregnancy. So yes, we are talking about holistic approach, we've talked about natural diet and everything, but somewhere there are certain supplements in pregnancy which are a mandate. So as an obstetrician, as
Absolutely.
an expert, what are those supplements that you 100% advise for pregnant women to take throughout their pregnancy? And also, we would love to know more about protein supplements because, some people say you need to take protein supplements. Some say, no, it's okay if you can't take it. So let's know more about all the kind of supplements as a doctor that you would like to advise to all pregnant women.
Absolutely, Mahima. Here, regarding the deficiencies and the supplements which we would advise, preconceptionally, right, this thing starts. And we advise the woman to take folic acid supplements 1 to 3 months
Hmm.
prior to the conception. So the holistic pregnancy starts from there itself, that you're healthy, your mind, spirit, everything is healthy. But holistic pregnancy does not only mean that there'll be no interventions or there'll be no supplements from the doctor, because the doctor obstetrician has to intervene when that red flag
Hmm.
comes. So
Yes.
here, holistically, in the first trimester and pre-conception, folic acid is a very, very important supplement. Folic acid is said to prevent, along with vitamin B12, is said to prevent any neural tube defects, that is spinal defects in the baby. You know, the spinal canal which we see, the spinal column which we see, there are other neural tube defects, brain defects which are there. So it is very important to give the supplement of folic acid preconceptionally 1 to 3 months and throughout the first trimester. Later on in
Hmm.
the second trimester, we combine the folic acid with iron, because initially in the first trimester, we require a folic acid of around 5 milligrams. Later on,
Okay.
about 800 micrograms of folic acid with iron is enough to tide over
Okay.
the rest of the pregnancy. But there are certain conditions, like one condition which I can remember on the spot is epilepsy. There
Hmm.
are some patients who are epileptic and they have become pregnant. They have to take their anti-epileptic treatment throughout the pregnancy, and in that
Hmm.
case, we do not stop folic acid. That 5 milligram
Okay.
folic acid is very important. Other supplements which are given are DHA and omega. They say in the first 4 weeks it is very important for the baby's brain growth. So
Hmm.
if you can supplement DHA and omega in the first trimester, that is of great help to the baby's IQ and the brain development. Here, another thing is why I was talking about thyroid is, and the importance of thyroid hormone in pregnancy is very important, because in the first trimester, the baby, the fetus is unable to form its own thyroid hormone. So the mother's
Hmm.
thyroid is very important, that she has a normal thyroid function test. If the mother has developed hypothyroidism during pregnancy and the TSH levels are very high, that does affect the IQ of the baby and some developmental
Hmm.
defect after the baby is born. So here, thyroid supplements have to be given to those women who have been shown to be hypothyroid in pregnancy, because the blood pregnancy hormone and the thyroid, they increase exponentially and they increase together. As the pregnancy hormone is increasing, the mother's thyroid is also increasing, and increase of TSH means a hypothyroid condition. So
Hmm.
sometimes the thyroid supplementations in some women are very important. As I said, DHA, folic acid, and omega, very important. In our nutritional practice and diet, we can give more of flax seeds, eggs, then other fruits, and multiminerals in the diet. So that is very important. Regarding protein, what happens that the
Hmm.
protein content, if the patient is a non-vegetarian, if the mother is a non-vegetarian, then non-vegetarian food, if it is less spicy and oily and it is baked or it is grilled, then the protein content is very good, especially if the woman is eating lean meat and liver.
Hmm.
So you get a lot of proteins, and in the fish eaters also, omega and DHA very good supplements. If the mother to be is a vegetarian, then what happens in vegetarians? We advise them to eat more of proteins in the diet through paneer, milk products, pulses, sprouts, steamed sprouts, dals every day,
Hmm.
along with iron rich food. Now, in case the proteins are not enough in the diet, or the patient is a little picky about her food, or she's not concentrating very well on keeping a healthy diet, then we advise the patients to take more proteins in the diet through protein supplements. Nowadays, most of the protein powders which are available in the market, the mother's protein powders, are usually low sugar or no sugar.
Hmm.
So usually all the brands which are available now, the companies have decided a no sugar policy for the protein powders. She can put one or two protein scoops in milk along with some dry
Hmm.
fruits and whatever else she needs, and she can get enough proteins through the milk. Some women are milk intolerant. So milk
Hmm.
products can be given to them, like more of paneer through veg food, or of course eggs and non-veg. And there are good protein biscuits which are also available,
Hmm.
which are also no sugar biscuits. They are called biscuits, Thriptin light biscuits, or some cookies which are available proteins. So
Hmm.
if the woman is snacking and she feels hungry every 2 hours, she can take some amount of protein through these supplements also.
So overall, if somebody is able to manage with good natural sources of proteins, like for example, someone who
Absolutely.
takes non-veg can still manage with
Yes.
natural sources, but someone who's
Absolutely. Yes. Yes.
definitely not able to manage for sure needs a protein supplement.
Yes, definitely. In the second trimester, around 30 to 60 grams of protein is needed in the diet.
Hmm. Okay. So, what about vitamin D and calcium supplementation?
Yes, so vitamin D supplementations are also, we in our armamentarium of tests which we do, sugar and thyroid and vitamin D and vitamin B12. So vitamin
Hmm.
B12 levels usually should be more than 500. Vitamin D should be around more than 50. So usually the vitamin D deficient women are given vitamin D supplements. Usually we start it in the second trimester. See what happens in the first trimester. Sometimes some categories of drugs, even the normal supplements or drugs, are categorized as category 2 or 3. Better to
Hmm.
avoid this and give it start of the second trimester. Usually what I do is vitamin levels along with the first trimester screening. I do the vitamin levels, vitamin B12 and
Hmm.
vitamin D3 at 12 weeks, and then start the woman on regular vitamin D supplementations. These supplements are available in calcium also, but they are very low. If a woman has the vitamin D less than 25, which is very, very low, then I would give
Hmm.
60,000 international units per week for around 12 weeks. And then as a
Hmm.
maintenance dose monthly. And in
Hmm.
those women who have vitamin D, which is normal, the calcium tablets are always fortified with vitamin D, either 1000 unit
Hmm.
or 2000 international units. So that much is enough. Plus some amount of walking
Hmm.
and exercise and sunlight. Sunlight
Hmm.
exposure also, I find that the women are not getting anything because they
Yeah.
are always in the office and in the AC.
Hmm.
So it's
Hmm.
good that they receive some sunlight, especially after 10,
Hmm.
especially in the winters is a lovely time when they can go out and walk
Hmm.
or
Hmm.
massage their body and sit outside
Also, can they
because it's
take some
fat
vitamin
soluble
D?
vitamin. Yeah.
Yes. Can they take
Pardon?
some sunlight, some vitamin D into the
Yes,
bump?
into the they can.
Hmm.
It'll
Yeah.
be good if they massage the skin a little bit with oil, and because then the vitamin D is absorbed very well.
Right. So I think very important for women to understand that, no matter how much we emphasize on natural diet, these supplements are something which are also an essential part of your pregnancy, and you have to listen to what your doctor is saying. You can't say
Absolutely.
कि आज मेरा मन नहीं है तो मैं नहीं खाऊंगी. These are essential part of your pregnancy, and you have to follow as per your doctor's advice.
Yes, yes, absolutely, absolutely. Because I find that because of their lifestyle, see, lifestyle
Yeah.
changes. See, you can't tell a patient. See, many times the couple comes to us and says, "Madam, what can I do?" And I can't tell them that you stop your job. You see, the thing
Yeah.
is that if they are unable to take out
Mm.
even a half an hour or 1 hour from their daily schedule. It's so hectic.
Yeah.
And in
Yeah.
today's lifestyle, I know that both the husband and the wife have to work. See, these are
Yeah.
some basic things which, we cannot stop them from doing all those things because that is their basic livelihood. But
Yeah.
somehow we have to tell them somewhere that take out at least half an hour for exercise, good diet. And one of the other tips of holistic pregnancy would be adequate rest and adequate sleep. Because
Mm.
I find that most of the couples, especially, are on the net and on the mobile. The
Yeah.
moment
Screen
you
hours.
leave the mobile and you try to
Yeah.
sleep, I think that
Yeah.
adequate rest
Yeah.
around 6 to 7 hours at night, 7 hours,
Yeah.
and two, at least 1 or 2
Mm.
hours, some kind of a nap, small power nap, or some kind of a,
Mm.
a little leisurely time, or a little, just if you relax at home on the bed, or even in the office, that 15 minutes of
Mm.
a power nap, and you try to, your neck muscles are paining, try to do your
Mm.
exercises. This is for everyone, but in pregnancy, with the growing, I mean, the long bones, the small bones, everything pains, the joints pain.
Yeah.
There is the relaxin hormone is increasing. That is why, you have hip pain and joint pain and neck pains, and sometimes the migraines increase. So, adequate rest and adequate hydration here comes to play, because most of the women are working. And
Mm.
even if those who are homemakers also, they are in their house, and probably they are not able to adjust the time for these things. That me time in pregnancies would be very important.
Hmm. Yes, absolutely. Because psychological health is an equal part of pregnancy to ensure that the baby's development is happening properly. And I think that, again, maybe somebody, who's working can take care on the weekend. So if at least not during the weekdays, आप weekend पे एक extra hour या 2 hours अपने लिए निकाल सकते हैं. You can do things like, relaxation techniques, listen to music, get some massages done from
Yeah,
your
and I
husband,
think in your pre-mom
spend
sessions,
some
Mahima, you
together
have been
time.
advocating. Yeah, you have been
Yes, yes,
advocating in
ma'am.
your pre-mom sessions so much about
Yes.
music therapy, because the
Yeah.
baby, the fetus, is listening to the mother,
Yeah. Yeah.
listening to the music that is, the mother is listening to. So I know that
Yeah.
you have beautiful, your teaching is beautiful for in pre-mom sessions, because I have witnessed it myself.
Thank you so much, ma'am. So our idea of having this pre-mom's wellness program is to give that holistic approach in pregnancy and to help expecting couples to, get that balance in their pregnancy so that they're able to take care of themselves and the baby.
And I would take this opportunity to tell our audience today that
Mm.
Dr. Mahima is doing such a wonderful pre-mom session classes. They are free of cost. They are for everyone. I mean, anyone and everyone can join her classes, and they are so holistic. And each and every one of my patients actually tells me that Dr. Mahima's classes are a blessing and a boon, because they've been able to imbibe so much of holistic
Mm.
approach in their lifestyles and in their pregnancies. So my patients are definitely holistically very happy after attending
So
the pre-mom
sweet.
sessions.
So sweet of you, ma'am. So sweet of you. So I
So
think
Wednesday,
since we're
Saturday,
discussing,
yeah,
yeah,
yes, I would
Wednesday and
advise
Saturday we
all
have our
my
classes.
patients.
Yeah.
Yeah, we have the classes. They are online, and you must join these classes.
Thank you so much, ma'am, for promoting
Thank you.
pre-moms. Also, I would like to ask you that there are certain scans that are essential in pregnancy. So, whether it's first, second, or third trimester, which is also an equal part of fetal well-being, since we are discussing about,
Yes,
wellness. So, if you could
yes,
also share some thoughts on what are those essential mandatory fetal scans that need to be done in the first,
yes,
second, and
yes.
third trimester, it'll really
Right,
help
right.
our audience to know more.
Yes, yes. So I'll discuss this in two parts. One part is that what are the scans and what are the tests to be done in the first, second, and the final trimester. So when the patient comes to us and she's just pregnant, at that time, naturally, she has done a urine pregnancy test and she has come to us. At that time, we would do her normal tests, the hemoglobin, thyroid, HB electrophoresis to rule out some blood disorders, some sickling or some thalassemia minor problems, serology, and we would ask her which vaccine she has received pre pregnancy, and go
Mm,
ahead with the first scan, which is the dating scan, which is to be done at around 7 weeks. So that is the time when the scan shows the heartbeat in the fetus. Now, in some instances, what happens is if there has been a bad obstetric history, a previous history in which there has been a miscarriage or a previous neonatal death or some abnormalities, especially. recurrent miscarriages, then we would tell the patient whenever she comes to us to do a transvaginal, that is a TVS scan, to understand whether the baby is in the right position, that is in the uterus or not. So that
Mm.
scan, the meaning of that scan is that the baby is in the uterus. It is not in the tube, because there's something called an ectopic pregnancy, in which the pregnancy may be in the tube because of some previous history. Otherwise, the
Mm.
first dating scan is to be done at 7 weeks. After that, when you start the supplements and everything, the next scan is the first trimester screening. So, the first trimester screening is for Down syndrome, trisomy 13, 18, and 21, in which we would
Mm.
do a combined screening, in which we do a NT scan or a nuchal translucency scan, in which the thickness of the baby's neck is seen, the nasal bone is seen. There are some markers which are seen in the scan to rule out Down syndrome. And concurrently, on the same day or the next day, we do a blood test called the double marker test, which is a screening
Mm.
test for the first trimester, also for Down
Mm.
syndrome. And in case the woman is above 35, or she has some previous history of some anomalous babies, then we would tell her to do the NIPT, which is the non invasive perinatal screening test, which is a better screening test than the Down syndrome, than the double marker.
Mm.
After
Mm.
that, the next scan after the 12 weeks or 13-week scan would be the anomaly scan, which is also called the TIFA scan, in which the whole, all the organs of the baby from top to bottom are scanned. Each and every organ of the baby, spinal cord, everything is scanned to know whether there are any anomalies. So, very, very important scan to be done at around 18 to 20 weeks.
Mm.
After that, there is a very important scan which would tell us about any heart defects in the baby. So
Mm.
nowadays we are advocating the fetal echocardiography. As you know, in elders we do the 2D echo. Supposing I go for a checkup, 2D echo ECG. So similarly in the baby, it is called the fetal echocardiography. At around, it is before 24 weeks. So maybe 23, 22 to 24 weeks. It's not a mandatory scan, but I suggest that if it is possible, each and every patient should do it, because there is more
Better to get it
advantage
done,
of doing
safer to
this,
get it
better to get
done.
it done,
Yeah.
safer. And then 6 weeks
Mm.
lead scans for growth and Doppler. So here in the later scans, say about 28 to 30 weeks and then 37 to 38 weeks, these scans are basically to show the growth of the baby. Is the baby
Mm.
growing well? Because by that time we know that there are no major anomalies in the baby. But another
Mm.
thing is, we are seeing the placental localization in each scan from 12-week onwards. So we can
Mm.
tell the patient at that time, is the placenta at the upper segment? So go ahead and do all the holistic exercises that Dr. Mahima is telling you
Mm.
to
Yeah.
do. Otherwise, we have to also see whether the placenta is at the lower side or
Mm.
at the upper side, and see the growth of the baby, see the amount of amniotic fluid in the baby,
Mm.
other developmental abnormalities is the baby having. And then the last scan would be for the Doppler. Doppler means, Doppler studies are done to two things are there. One thing is the whether the uterus is getting enough blood supply or not. So that is called
Mm.
uteroplacental insufficiency, in which the baby may land up into growth restriction, and the mother may land up into a BP problem, that is hypertension. So initially, the
Mm.
Dopplers which we do in the initial scans are for uteroplacental insufficiency. Later on, as the placenta and the umbilicus develops, and umbilical arteries flow is seen, to know whether the placenta is giving enough blood to the baby as the baby is growing. So Doppler scans later on would be to show the blood supply. And the blood supply, very interestingly, a sonologist is seeing in the brain, whether the brain of the
Mm.
baby is getting enough blood supply, whether the umbilical artery is giving enough blood supply and oxygen to the baby, and how the baby is growing. So these are the
Mm.
various scans. Regarding the investigations, as I told you initially, at 12 to 14 weeks we do the vitamin levels, and of course again the test for sugar. And later on, as the incidence of gestational diabetes is more 24 weeks onwards, even gestational hypertension also, which is called pregnancy induced hypertension. The test for urine for hypertension, GCT, which is the sugar test, and again the test for hemoglobin, because it may drop in the second trimester. So all these tests are recurrently done, also with the liver and kidney function tests of the mother.
Nice. So I think it's very important for couples to know, for would-be parents to know कि आपके टेस्टिंग क्या है, स्कैन्स क्या हैं जो आपको ज़रूर कराने हैं, because it's always better to be safer beforehand rather than later on regretting in life. और ये सारे टेस्टिंग, ये सारी investigations we easily do at Sahyadri Hospital, so you can feel very comfortable to come over to not just meet our obstetrician Dr. Mini Salunke in the hospital, but also to get all these investigations and scan done under one roof, and also to join our pre-moms wellness program so that we are there to take care of your holistic well-being in pregnancy. If audience has any questions, can feel free to ask us. We'll be happy to answer. Until then, I think, ma'am, just one more point that I would like to ask you is that
Yes,
overall,
yes.
that one message that you would like to give to every would-be couple, would-be parent, basically, that what is that one message from your side in terms of that care of, a pregnancy that needs to carry on at home, apart from the medical advice, apart from the diet and exercise, वो एक extra message आपकी side से जो घर पे family members को follow करना है to take care of the pregnant women at home.
My take home message for the my audience and for the moms is that, believe it or not, pregnancy is physiological. We were always taught that pregnancy is a physiological thing. There is nothing pathological until proved and until your obstetrician points it out to you. So the basic foundation of a holistic pregnancy is be healthy physically, be healthy in mind, and be healthy in spirit. So follow the mantras of healthy body,
Yeah.
keep your weight in check, keep your sugar in check, do your regular exercise, eat healthy, cheat days maybe once in a week. Be healthy in mind, have a happy pregnancy, learn to complain less about the normal aspects and the normal shortcomings which will be there in the pregnancy. I feel that a happiness would lead to a happy baby and a healthy delivery also. Now, regarding delivery also, see, most of the women would say, Madam is saying this, but tomorrow हमारा cesarean भी हो सकता है. There are so many cesarean sections nowadays. So, Madam is saying, Arey, you eat healthy and happy. That is not the
Yeah.
mantra for a normal vaginal delivery. Normal pregnancy and normal delivery. See, according to the scenario at the time of the childbirth, just before the birth, any obstetrician would feel that a safe mother, a safe baby, and a safe delivery is
Hmm.
most important. So
Yeah.
there the obstetrician, through her skills and her knowledge, would try to impart and educate the patient and the couple. Ki, see, this is what I feel that here your safety or the baby's safety lies in a cesarean section because of this. But
Hmm.
each and every obstetrician, if the patient is a normal healthy pregnancy, would definitely try and pull you through a normal delivery. Normal delivery for me means normal outcome, not
Hmm.
necessarily a normal vaginal delivery or a vaginal delivery or a cesarean. The outcome means a safe and healthy pregnancy, safe and healthy delivery, and safe and healthy baby. So
Absolutely.
this is my mantra, and this is my take home message for the women, that sometimes, there is a myth that when you're saying
Hmm.
holistic pregnancy, that means both Dr. Mahima and Dr. Mini Salunkhe are advocating that all the mothers will deliver normally vaginally.
Normally.
I wish that this could happen. I wish that this could happen. But trust me, there are so many problems sometimes faced in the
Yeah.
pregnancy and last moment in the delivery. So
Hmm.
you be happy and you be content, and listen to yourself and listen to your doctor, because your doctor, believe me or not, I would tell my patients that I am more concerned about the way you deliver than you are, because the whole responsibility lies on me.
Yeah.
So,
Yes.
no doctor, believe your doctor. I mean, one of the first steps in a
Hmm.
holistic pregnancy today would be that believe your doctor and choose the doctor carefully, so that
Hmm.
you know that this you have faith in your doctor that she would not do anything which would be harmful.
Totally, absolutely, ma'am. And also important in case by any chance your pregnancy converts into a high-risk pregnancy, or at the time of delivery, you kind of require an extra support from other departments if it converts into a high-risk delivery.
Absolutely.
So at Sahyadri Hospitals, we have that, multidisciplinary approach to pregnancy and delivery.
Absolutely.
We have all the facilities available under one roof to take care of any high-risk pregnancy or delivery. And most important, we have our, super fantastic doctor, Dr. Mini Salunke, to take care of you during during your pregnancy and
Thank you.
delivery.
Thank you.
So, to all the viewers, if you want to come and consult, ma'am, she's available at Sahyadri Hospitals, Hadapsar. You can always take an appointment before coming if you want. But please feel free to come and meet ma'am at Hadapsar Hospital.
Thank you so much, Mahima. I like this point very much, that what is the uniqueness of the hospital. And another
Mm,
thing is how to choose the doctor in the hospital. So doctor, to I told you, but choosing the hospital is very important. Good NICU facilities and good
mm,
multidisciplinary approach, because pregnancy being a very volatile, it is a very volatile kind of a topic, and it is a very volatile
mm,
condition. So here what happens, being a hypercoagulable state, anytime the pregnant woman may require some blood at the last moment, a physician's help, an endocrinologist help. So here when we require a surgeon's help, so here when we require help from the blood bank facilities. So these facilities
mm.
are all available in MomStory, and I feel that this is a very safe way to practice.
Right. So, our best wishes from the team Sayadri to all of you to take care of your pregnancy and delivery. And we all will be very happy to help you for your pregnancy and delivery. Don't forget to visit us. You can come, do a show round, see our facility. We'll be happy to explain everything to you. And most importantly, we'll be happy to make you meet our doctor, Dr. Mini Salunkhe at Sahyadri Hospitals, Hadapsar.
Absolutely, and I would request all my the audience and all my mothers to be that please do join the pre-mom sessions with Dr. Mahima. They're absolutely amazing, and they have led to holistic pregnancies in all my patients till now.
Thank you so much for your kind words, ma'am. Thank
Thank
you.
you. Dr. Mahima keeps visiting Pune. She keeps taking master classes. Whenever we advertise regarding her coming to Pune, I think all of you should come and meet us, our whole team, Mahima, along with our other the obstetricians and other people. We have lactation experts, we have
Hmm.
nutritionists, we have physiotherapists who are trained, and they are participating in Dr. Mahima's pre-mom sessions also. So it will be a kind of a very very novel experience for you, because even during the pregnancy, we
Hmm.
always tell them to meet the dietitian nutritionist in the first trimester and in the other trimesters, the
Hmm.
physiotherapist, and especially the lactation expert in the third trimester, because feeding the baby is also a very new thing for the new mom. A
Hmm.
primey, that is a first pregnancy mother, she doesn't know much about the colostrum and the milk secretion and how to feed her baby and how to latch. So all these things are also taught, and we give preference and we give emphasis to these things.
Sure. Thank you so much, ma'am. Thanks a lot for sparing time. We understand you have a busy schedule, but you still managed to take out time for this live session. So thank you so
Thank you,
much for
Mahima, and
that.
it was great to have the show with you, great to have this talk with you, and
Thank
see you
you.
soon.
Absolutely. Thank you so much, ma'am. It was a pleasure.
Thank
Thanks a
you,
lot.
doctor, thank
Thank
you,
you to
Mahima.
your audience. Namaste, everyone. Take care. Bye bye.
Thank you, bye bye.